Birth control options in the US. Long-acting methods. Today, we will learn about different birth control options available in the United States. Birth control, sometimes called family planning or contraception, gives women the power to decide when and if they want to become pregnant. Some people call this reproductive life planning, reflecting on the choices women have in making these decisions. There are many types of birth control. By understanding what types are available, how they work, and what you like and don't like about each type, you can choose the best method for you. When choosing a birth control method, an important thing to consider is how effective each option is. The more effective a birth control method is, the better it is at preventing pregnancy. If you don't plan on becoming pregnant for a few years or want to avoid getting pregnant, you might choose a long-acting method, like an IUD. If you plan to become pregnant soon, you might want an option that can be stopped or reversed quickly, like a short-acting hormonal method such as a pill or a barrier method like a condom. Additional things to consider are accessibility. How easy is it to get? Some birth control methods require a doctor's appointment and a prescription, while others are available at local pharmacies without needing to see a doctor. Frequency of use. How often you use a birth control method can vary. Some are taken daily, some weekly or monthly, and some last for years or are permanent. Privacy. Discussions about birth control can be done in the privacy of a doctor's office. However, you may need to get some types of birth control at a pharmacy or places outside the doctor's office. Affordability, or how much the birth control costs, is another factor that can influence your decision. Health insurance may cover the cost of birth control. Other things to think about are possible changes to your period, if it is safe to use while breastfeeding, or other side effects. Some birth control cannot be used with certain health conditions, and different birth control methods might work best for you at different stages of your life. Your doctor can help you choose what birth control is right for you. Remember, everything that is said to your doctor is private and cannot be shared with anyone, including husbands or other family members, without your permission. We discuss birth control options in the United States in 3 videos. Long-acting methods, short-acting methods, and barrier or natural methods. In this video, we explore the most effective, long-acting types of birth control that can be used for an extended length of time: sterilization, IUDs, and implants. For any birth control to be effective, it must be used consistently and correctly. Long-acting birth control methods involve a procedure and have the lowest risk of pregnancy. They are 99% effective in preventing pregnancy. These types of birth control methods do not require you to take them on a regular basis, so you don't have to remember to take them. Sterilization. Female sterilization and male sterilization are safe and effective surgical procedures that permanently stop a woman from getting pregnant. Women and men sometimes choose sterilization when they are sure that they do not want to have more children. These surgeries are performed by doctors, and an appointment must be scheduled. Female sterilization is called tubal ligation and can be done at any time, but women can also request sterilization during their hospital stay when giving birth. This procedure does not affect a woman's period or their ability to breastfeed. Some rare side effects are pain, bleeding, and risk of infection following the surgery. Male sterilization is called a vasectomy. A vasectomy is a medical procedure that can be performed at a doctor's office and takes a few days to recover with little to no side effects. Only one person in a couple needs to be sterilized to permanently prevent pregnancy. IUDs. IUD stands for intrauterine device and is used in both Afghanistan and the United States. IUDs come in 2 forms, with or without hormones. Hormonal IUDs release a small amount of hormones called levonorgestrel. Depending on the brand of the IUD, they can be used for 3 to 6 years. They can make your periods lighter, reduce monthly cramps, and in some cases, women may experience no periods at all. Copper IUDs don't contain any hormones and can be used for up to 10 years. Copper IUDs may cause heavier, longer periods and cramps. With either option, a woman can schedule to have the small IUD device placed inside the uterus by a doctor. This is a procedure that can be painful, but it only requires one doctor's office visit. Once an IUD is properly inserted, it should not have any impact on sexual activity. You can breastfeed if you have an IUD. IUDs are not visible to anyone, and you do not have to remember to take them since the procedure to insert an IUD only happens once. Some people have cramping and spotting after the IUD is placed, and you should talk to your doctor if it continues to bother you. You can have an IUD removed by a doctor at any time, and your ability to become pregnant returns. Implant. An implant is a small rod the size of a match that is placed under the skin of your arm during a scheduled appointment with a doctor. It releases a small amount of hormones to stop women from becoming pregnant. The brand most available in the US is called Nexplanon. It is considered the most effective type of birth control that is available in the US and can be used for up to 3 years. Implants are very hard to detect by anyone since they are placed under the skin of your arm. The most common side effects are irregular periods, though most women will only have light bleeding or no periods at all. Some women may experience weight gain. Like the IUD, the implant can be used while breastfeeding, may reduce monthly cramps, and once removed, your ability to become pregnant returns. Sterilization, IUDs, and implants are birth control methods that require you to see a doctor to get them. Medical insurance, including Medicaid, usually covers the cost of these procedures. Consult your doctor to help you decide if these long-acting birth control methods are good choices for you. Remember, you can request a female doctor if it will make you more comfortable. You can also request interpretation at your doctor's appointment by saying, "No English, I speak Dari," if your doctor does not speak your language. Having interpretation can ensure that you are able to ask your doctor any questions, maintain privacy, and make an informed choice when discussing birth control options in the United States. Take the time to discuss your options with your doctor. Remember that your healthcare provider is there to support you in making the right choice for your unique needs and values.